Hi everyone, my name is Dr. Rick Seguil. I want to thank you for checking out my website and my practice. So I am an integrative medicine physician. That means I took residency in family medicine for 3 years. Then I went on to do a sports medicine fellowship to learn about musculoskeletal medicine for a year. Then I worked in practice for a while, and I decided to do an integrative medicine practice, and that's a 2-year practice that essentially takes you from residency to the next level. We learn about the practices in other cultures. That's considered a whole system approach, like traditional Chinese medicine or Ayurveda. And also we learn about nutrition, about mindful practice. We learn about other things you don't have time for in residency training, especially primary care. And you have to admit, with enough information, your doctor should be able to come up with a great plan for you. And it should be personalized. The problem I find nowadays is that with the ecological fallacy and the time constraints that we as doctors have when we bill insurance, you only have a certain allotment of time. I mean, it would be great to spend an hour with everybody, but if insurance can pay from 0 reimbursement to 80% reimbursement, that's variable. And if you're going to run a business, how can you successfully run a business and put out product, which is healthcare, when you can't even guarantee that you'll stay afloat with regards to paying the bills? Malpractice, overhead, staffing, billing. Bottom line is that, unfortunately, it is a medical practice, and that is a business that has to be taken into consideration. But by far, my #1 priority for running this practice and having my small subset of patients is to provide personalized care. So let's talk about that. Personalized care is very unusual because nowadays you go to a doctor that's on your insurance, you make an appointment, it's probably a couple weeks out. Hopefully it's not for a specialist, because if it's a specialist, then you already have a disease that you're starting to manifest. If it's for a generalist, a primary care doctor, or your average family practice doctor, internal medicine doctor, a pediatrician, then that's cool. That means you're seeking out a doctor's help and you haven't either manifested the disease or you haven't turned up positive on any of the tests yet, which is great. But what's inevitable is that we all age. Whether you're a couch potato or an athlete, whether you're 20 or 60, whether you're male, female, or whether you have a disability, we all age. And as you age, you will take on symptoms and disease. Most of the diseases nowadays that people die from would be heart attacks is #1, cancer #2, and then neurodegenerative disorders is #3. Then how do you beat that? Well, it comes down to a personal plan. If you don't have a personal plan that's made for you, you're shortcutting your chances. I believe that all of us have strengths and weaknesses. And as long as you identify the strengths and you embrace them, but you also neutralize and quiet down or reverse the weaknesses, I think that you're setting yourself up for success. And that's my job. That's the job of the physician. Physician ultimately comes from the root word teacher. And we're supposed to teach you things to not need a doctor and not need a hospital. But to do it on your own, you can if you know how to use the information, which is vast on the internet. And there's a lot of good information out there. There's a hierarchy of evidence that if you follow it, it'll give you the best suggestions. But unfortunately, you have to be really good at reading the hierarchy, knowing which is useful information, which is not, meta-analyses versus RCTs versus cohort studies. All that's very important, and we study that in integrative medicine. And that's the job of the doctor, who is supposed to be the teacher, and I also consider myself a translator of information. If you are not getting anywhere with your current primary care doctors, or if you find that you're too knee-deep into your medical problems and your symptoms and you're on a lot of medicines, or you're bound for having a surgical procedure, I think we can still optimize you using the practice of integrative medicine. All this stuff together is supposed to help me act as your advocate for the best kind of health that you can manifest with the smallest amount of changes. Now, if I was to tell everybody, okay, I want you to be plant-based, I want you to run marathons, and I want you to lift and be super muscular with 2% body fat, see you in a year. I think those are valid suggestions, but obviously not even the best athlete can manifest that. So it has to be tempered a bit. It has to be personalized. and it has to be constructed with the ideas about your strengths and your weaknesses and your resources. So that's where membership-driven practice comes in. I think it's important to have a business model. If we can sustain this in a small community and also empower you with personalized suggestions, I think everybody's going to win. At least we can be the nucleus of a tribe of healthy people that will inspire other people to change. With membership-based medicine, we do take insurance, and we do use a billing system to send out to your insurance for the things that we render in the office, the medical advice, the time. It's essentially a retainer. And when you sign up for the test drive in my practice, it would be to at least give you one visit to just taste what we can put together and how I would treat you as a patient and as a human being. If you're happy, then you can take the money allocated for the test drive and then apply it to the annual membership. And hopefully from that point forward, your annual membership will be billed on an automatic basis. In my opinion, it's always good to have different eggs in your one basket. And along those lines, I would never get rid of your primary care doctor. Because my practice is virtual, I would highly suggest that you still keep your primary care doctor so you can make a visit immediately if you have sickness. What I've experienced lately, though, is that even if you have a primary care doctor, they probably can't get you in that quick, so they send you to the immediate care center. And that's fine too, if that's the way of Western medicine. But you should still keep your primary care doctor. You should still keep your specialist. We just might get you so healthy you don't need the specialist anymore, and you don't get sick anymore, so you won't need your primary care doctor that often. I think it's always good to have second opinions. It's always good to keep your medical insurance for catastrophe, just in case. But it's also very good to build up and improve your lifestyle so you avoid the catastrophe. So if it does happen, like a car accident, at least if you're optimized, then you'll bounce back faster. Let's face it, if you're old, you look 10 years older than your license age, that's going to be a problem if you run into injury, catastrophe, the next pandemic, work problem. So I think it's always better, even if you're young and you don't have any symptoms, to consider optimizing your health. I think it's outstanding to go to an integrative medicine doctor. I have a lot of colleagues that also graduated from my fellowship at the Arizona Center for Integrative Medicine, which is, I think, the pinnacle of integrative fellowship training. If you have your own doctor and they are doing a good job and you are on your way to healthiness, then stay at what you're doing. But if you want an opinion and you want a different approach that might work just better than what you're already deploying, then please consider at least a test drive. I guarantee you'll be satisfied with what we put together for your plan, your narrative. If not, the alternative is you will have to be the advocate versus me. So hopefully this gives you a couple of ideas. I think it's worth it. I've developed this practice to my personal approach, and hopefully it works for you like it's worked for my other patients in the past. All my visits are virtual at this point in time. I have to travel frequently. I also run my excursion services where I take people to high altitudes and awesome hikes for the rewards that they've invested in their lifestyle change. So please consider the membership. If not, you can always join me on my YouTube channel where I put out content specifically for the population and the tribe and the community that I see. It might pertain to you, so stay healthy. Always question the information and do your best to avoid aging too quick. Thanks for watching. Hope to see you soon.